You've had your menstrual cycle for a few years now, but you're still not sure how to track it. Your doctor asks you when was your last period, and you're scrambling. If you want to find out how to track your period and understand how it affects your body, let's talk about it. I'm Dr. Kim Somerville, your general practitioner and clinical nutritionist, and I help women manage their PCOS and blood sugar. In today's episode, we're going to be talking about how to track your menstrual cycle, understand why it occurs, how it occurs, and how you can know if your body is doing the normal thing or if there's something that you need to talk to your doctor about. Firstly, why do we even have menstrual cycles as people with a uterus? It's always a pain usually, and sometimes you just really want to skip it. But the point of the menstrual cycle is to allow your body or your uterus to get prepared for pregnancy. Once you start having your period in your preteen or teenage years, you will be having that cycle all the way until menopause. And it is to make sure that you are able to get pregnant when you are ready. But sometimes our periods are not regular and we aren't really able to know if we're able to get pregnant if that's something that we really want to do. Today, I'm going to let you know about how to track your period and understand what is happening when certain symptoms occur. What is a menstrual cycle? So a menstrual cycle for persons with a uterus and ovaries occurs when there are changes of hormones throughout a set time period. Typically, we consider that to be a month or 28 days, but it is considered normal for a menstrual cycle to be from anywhere from 21 days to 35 days. The first day of the menstrual cycle is considered to be the first day that you start bleeding. That can be a small amount, which would be considered spotting, or it can be a little bit heavier than that. That will be considered our first day. The last day of our menstrual cycle will be considered the day before the other cycle starts. I'm going to be using an example with a calendar later on, so stick around for me to give you a real life example. Some persons think that your period should always land on the same day every month. For example, you had a period on March 2nd, so you're expecting in April for it to start the 2nd as well. It doesn't typically have to go that way. It can be 28 days leading you to probably April 1st, or it can change a bit each month with about plus or minus 4 days. For example, you have a 28-day cycle and next month it might turn into a 27-day cycle. And the month after that, it might be a 24-day cycle. This is still considered normal. When it comes to the length of time that you should have a menstrual bleed, typically it is normal if the bleed is anywhere from 2 days to 7 days. The flow usually looks the same. It should be bright red. It shouldn't be very light and should not have lots of clots because clots typically represent a very heavy flow that may lead to things like having a low blood count or anemia. Let's talk about the phases in our menstrual cycle and how that relates to the changes in our body around that time. There are two specific phases, the follicular phase and the luteal phase. Let's start with the follicular phase. This section of our menstrual cycle is considered starting from the first day of our period all the way until we ovulate. And ovulating or ovulation means releasing an egg from our ovary. Now here I have a model of the reproductive organs in a woman's lower abdomen or pelvis. Here we have our two ovaries, 1, 2. And we have 2 fallopian tubes, here and here. And we have our uterus or womb. And this also is considered our cervix. This area is considered our vagina. In our follicular phase, we find that we are bleeding from our uterus, which sheds into our vagina and comes out of our body. That typically lasts between 2 to 7 days. But there are different hormonal changes that are happening in our brain, which signals our ovaries to start producing an egg. We have immature eggs in our ovaries, and as their hormones from the brain stimulates this ovary, it then begins to develop a dominant follicle, or what we consider the egg. As we start bleeding through our uterus, an egg starts to develop in our ovary. Over time, that egg starts to produce more and more estrogen in the follicular phase. What that estrogen does, it starts to increase the amount of blood and tissue in our uterus after the menstrual cycle has just ended. So there is more tissue, more blood preparing for the egg to be released and possible pregnancy. So while this is occurring in the uterus, the estrogen makes the cervix a little bit softer and the mucus in the cervix to be a little bit thinner in order for a sperm to come through the cervix and fertilize the egg. At the end of the follicular phase is when the egg has completely formed and now will be released into the fallopian tube. During that follicular phase, when we have an increase in estrogen, we might find that we experience some bloating, some cramping, a little bit of breast tenderness. And after the period finishes, that estrogen also allows us to have a better mood. We also have increased energy and find that when we're exercising, there's much more that we can do, can lift, and we feel overall better in our body when our estrogen is getting high in that phase. Now we're moving on to the luteal phase, and this happens at the point of ovulation all the way until the next menstrual cycle. The length of the luteal phase is usually 14 days, but the follicular phase that happened before can be anywhere from 7 days to 21 days. So the time of ovulation is a little bit different depending on the length of your menstrual cycle. So, as we know, the luteal phase starts when ovulation occurs. That means that an dominant egg is now released from the ovary, brought into the fallopian tube, and makes its way down into the uterus in order to get fertilized by sperm. At this point that the egg is released, our estrogen slowly reduces. But progesterone, which is another hormone, then starts to be produced by the corpus luteum, or what is left behind when the egg has now come out. What that progesterone does is starts to thicken the walls of the uterus a little bit more blood, more tissue, in order for the egg to comfortably sit and possibly get fertilized. It also then thickens the mucus in our cervix to prevent any further sperm from getting into the uterus. Around this point of ovulation, because estrogen has now decreased and progesterone is increasing, we may find that we are getting tired, having a little bit of mood swings, probably we are having brain fog, we're not really concentrating as easily as we did before, and we might find that we have an increased amount of libido or sexual desire during this time of ovulation and the luteal phase. After about 14 days or the end of the luteal phase, once that egg in the uterus has not been fertilized by a sperm, there is a rapid decrease in the estrogen and the progesterone hormones. So at this point, that decrease then signals to the lining of the uterus that it's time to shed off as a menstrual period. Around this time, because of those hormones decreasing rapidly, you find that you are even more tired, even more fatigued, and possibly even experiencing depressive symptoms. So now that we know what a typical menstrual cycle looks like, we want to then understand what does it look like when it is irregular. Usually what happens with an irregular period is that some persons may not ovulate. They may not release an egg from their ovary when the time comes. Now, if this is happening, remember what we said, that estrogen is being produced by the egg when it fully is formed. However, if it is not formed and released, then progesterone is not released and estrogen continues to just be increased for some time. When that estrogen continues to increase, we find that the lining of the uterus remains thick for long periods of time, sometimes for persons for 2 months, 3 months, or even years. And after a while, once it gets very, very thick and the blood cannot supply all of the tissue anymore, you might find a sloughing off of that blood that looks like a menstrual period, even though there was no ovulation occurring. This can sometimes happen to children or women who have just started their menstrual cycle from about 1 year to even 3 years after your first menstrual cycle, or for persons who are in perimenopause when they're just about to have their last period in the age typically around their 50s. For persons who are not close to the start of the period and not close to menopause, there still may be times when there is no ovulation, and that can occur because of things like polycystic ovarian syndrome, thyroid disease, or even high prolactin levels. If it is that you think that you're having an irregular period, this is definitely something to speak to your doctor about, because it may be anything from not ovulating to having structural issues in your uterus, your cervix, or even your vagina. I'm putting on the screen tracking of a period from the month of March to April. We'll understand the length of our menstrual cycle, the length of our menstrual period, and how it can change and look different even when it is normal. So here we have the month of March and April. Our first spots that we can see in red will be considered our flow of our menstrual blood. So the first period starts on March 2nd. When your doctor asks you, when was your last menstrual cycle? It should always be the first day of your last period. So in this case, one of the last periods was March 2nd. Now we can see here that bleeding resulted in March 2nd all the way to March 6th. So we would consider this person having a 5-day menstrual bleed or menstrual period. Now, in order to find out the length of the menstrual cycle in March, we should be counting from the first day of this person's menstrual cycle all the way until the last day before the other period occurs. So if you count with me from March 2nd to March 29th, we find that that first menstrual cycle is 28 days long. All right. Now you realize that this person had a menstrual flow starting on March 30th as well. Sometimes I have patients who say, "Doc, I have 2 periods in 1 month. Is that normal?" Yes, sometimes it can be. If it was too short, now that would be an issue. But as we just calculated, it was 28 days. The second period started on March 30th. If we count those number of days that their bleeding occurred, it occurred from March 30th until April the 3rd. And that again was a 5-day menstrual period. For us to now find out what was the length of the cycle from March 30th all the way down to April 29th, when we count that, we find that that cycle was 31 days. Still normal, but a little bit longer than the previous 28 days. And again, we also realized that she had bleeding in the first part of April and bleeding at the last part of April, and this would still be considered a normal menstrual cycle. Generally, some patients may also ask, "Doc, how can I know when I've ovulated?" Now, if you have a normal cycle and it is the same length every cycle, that is pretty easy to figure out. It is usually 14 days before your next period occurs. Now, you would probably say, but I don't know when my next period occurs. If you're using your calendar or using an app, you should be able to get a proper estimate of when your ovulation would happen. So let us look back into March. Here we see that the second period in March started on the 30th. We would then count back 14 days to figure out around what time ovulation may have occurred for her. So in this case, her ovulation may have occurred around March 16th, counting 14 days back from March 30th. And that is still 14 days after March the 2nd. Now, looking back into April, we would count 14 days from April 30th, and that would still give us around April 16th. But when you look here, you realize that that is around 15 days after April the 1st. So it changes a little bit when the length of your cycle changes, but it will always be 14 days before the other period starts. I hope this is clear for you all. If you have any specific questions, please leave them in the comments below. I hope you understand a little bit more about your menstrual cycle now, how to track it, how to know how your moods and your energy changes along your menstrual cycle, and if it is irregular, what to tell your doctor in order to find out what could be the cause. This is Dr. Kimberly Somerville from Simple Summer Naturals, giving you simple nutritional and medical advice for your daily life. Take care.